I am an orientation and mobility specialist.
I'm a lawyer.
I'm a firefighter.
I'm an advocate.
I'm a sister.
I am a mother.
I'm a friend.
I am me.
I have bipolar disorder.
Depression.
On borderline personality.
I'm not embarrassed.
1 out of 5 people lives with a mental health condition.
We're all people, and if we talk about it, there's hope.
Hello, everybody. I'm Matt Smith, board member of the Anti-Stigma Coalition. And on behalf of all of us, I'd like to welcome you to the latest in our series of Facebook Live events. This time, we are focusing on the state of stigma, postpartum depression, and how it impacts families. 1 in 5 women will experience a mental health issue during the first year following pregnancy, and 75% who experience maternal mental health symptoms go untreated. Why do so few women seek out help at this important time of their lives? What's getting in the way? What does this mean for other family members and loved ones close to the situation? Today, our panelists will explore these and other related questions. Now, before I introduce our panelists, here are a couple of housekeeping rules. Our program is for just 1 hour. During this time, if you have a question or comment, please type it into the chat box and we will respond accordingly. Your questions often lead to some great dialogue, so please don't be shy. Now, it gives me great pleasure to introduce our panelists for this time. LuAnne Brown. LuAnne has served as the CEO of the Buffalo Prenatal Perinatal Network from 2015 to today. BPPN's focus is to improve pregnancy outcomes, promote better maternal and infant and child care health, establish better linkages between existing programs, and ensure that families have access to the full range of preventative and primary health care, social support, and educational resources in Erie County. The agency currently houses the Healthy Families Home-Based Parenting Program, the Maternal Infant Child Healthcare Collaborative Community Health Worker Program, and the Responsible Fatherhood Initiative. LuAnne holds a bachelor's in nursing and a master's in nursing administration. Prior to a role at Buffalo Prenatal Perinatal Network, LuAnne was in various nursing administrative positions at Women and Children's Hospital of Buffalo, part of the Kaleida Health System, including Director of Maternal Neonatal Nursing, Director of Surgical Services, and Chief Nursing Officer. Welcome to our panel, LuAnne.
Thanks, Matt. Good to be here.
Wonderful. Next up, Lexi Harrod. Lexi is the vice president and co-founder of Melinated Moms of Western New York. She was born in Rochester and raised in Buffalo. She obtained her BA in social gerontology from the University of Buffalo and recently completed her master's in public health from North Central University. Lexi was the director of social services for over 10 years, serving the geriatric population of Western New York. She has built relationships with local leaders and has been working diligently with local community organizations to advocate for equitable maternal health care. Through her lived experiences, she knows how it feels to be treated unfairly within the healthcare system, and this motivates her to keep fighting for future generations. Lexi is a wife and a mother of 3 who had 2 miscarriages between her first and second children and can speak firsthand on the importance of having support. Lexi is also a certified doula. Thanks so much for being with us, Lexi.
Thank you. I was happy to be here.
Wonderful. And lastly, we have Julie Rosinski. Julie is a licensed clinical social worker and certified perinatal mental health counselor. She has 22 years of experience in providing psychotherapy to adults in community, university, and private practice settings. Julie currently maintains a private practice in Orchard Park, New York. She is co-director of a nonprofit organization called the Western New York Postpartum Connection, connecting new families with postpartum mental health resources. Thanks so much for joining us today, Julie.
Thanks for having me.
Wonderful to have all of you. Welcome again to all of our panelists, and thank you for joining us today and lending your voice to this very important topic. So let's get started by hearing about each of your programs, who you help, what services each organization provides. LuAnne, why don't we start with you?
Sure. So Buffalo Prenatal has been around since 1987. And as Matt mentioned, our primary focus is reduction of low birth weight infant mortality rates. We have 3 programs. 2 of them are women's programs. Those are home visiting programs. One is Healthy Families New York, which is part of Healthy Families USA. And they engage with pregnant moms, pregnant and parenting moms. And then We set up a schedule for home visits when the baby is born. We're in there every week for 6 months. And this program covers, I'm going to cough, right? This program covers child development, parenting, prevention of child abuse and neglect, but also works with the moms on self-sufficiency. We follow the family until the child is 5, so there's a long relationship there. The other program is our community health worker program, and that program works with the same population. We primarily work on the east and west side of Buffalo with African American Hispanic moms because they have not the greatest outcomes. So the community health worker program is a similar population, but they're looking for moms that are not connected to the system. So they probably get 70% of their referrals from street outreach. We go to train stations, bus stations. And the first thing they do is they make sure the mom's got health insurance and a provider. And then we work on all the social determinants of health, housing, food, baby basics. And we do a lot of education and advocacy for those moms. And they can stay in the program for 2 years. Both those programs, we screen for depression, substance abuse, and domestic violence. And then our newest program is our fatherhood program, which is also important because fathers have shown to also have an impact on moms as far as premature labor, depression, breastfeeding. So that's our newest program. And our staff are from the communities they serve. Probably about 15% of our staff are former program participants. So we have a group of our staff that speaks Spanish so they can interpret for the moms. And we have very good outcomes as far as immunizations, well baby visits, initiation into prenatal care, smoking cessation, breastfeeding rates. So that's what we do.
That's a lot. That's very impressive. Thanks for sharing that. Lexi, let's talk a little bit about Melinated Moms.
Okay. Hi, everybody. Melinated Moms is a nonprofit, and we love that term nonprofit because we're a community-centered women empowerment social enterprise that supports moms and women to become better versions of themselves through advocacy, education, awareness, and also entrepreneurship. We're able to provide a community that creates those opportunities for moms all across the melanated spectrum to connect with each other and empower each other and really put that right support behind them. We have our signature Find Your Roar training, which we provide, or we create that foundation, right, to advocate for yourself, not only for yourself, but for your child and your family as well. And we really pride ourselves on providing that representation and that community sense for all women across the melanated spectrum.
That's really, really wonderful. Could you please just help us with what exactly does melinated mean for anybody who might not know that?
Well, ta-da. So, melanin, the pigmentation in your skin. And we came up with that because we noticed that there wasn't a lot of help that was geared towards Black and brown women, right? So there's a lot of resources that are out there, but, there wasn't anybody that if I went down to, an office and I would see somebody there that would look like me, that would have the same lived experiences as me. So creating, melanated moms to highlight, the beautiful brown skin that we're in, that is important. And we'll probably get into this later, but representation in this space is truly important. A lot of the things that Black and brown women face are different from our white counterparts. How we are screened for postpartum depression, how we're screened for depression, how we're looked at in the medical field in general is completely different than our white counterparts. So this melanated moms is that representation that we want to see.
Thank you very much. I think that's an important thing we wanted to make sure we got.
Oh, you're welcome.
So thank you.
Yeah.
We also have Julie with us from the Western New York Postpartum Connection. Julie, let's hear about your program, please.
Hi. So the Western New York Postpartum Connection is a nonprofit organization. We've been a nonprofit since about 2020. Prior to that, we were a resource directory website, but we officially became a nonprofit in 2020. And our primary goals are to connect moms and families with good mental health care, with providers who have specific training in postpartum mental health. We also work on maintaining a network of providers of mental health professionals, as well as other support systems within the community, to be a part of our network so that we can have easy access to resources and easy referral for moms and families for mental health care, and other services that will support their mental health, such as services that BPPN or Melinated moms might provide, lactation consultants, pelvic floor therapy, all sorts of different providers that are familiar with postpartum mental health and can support a mom's journey. So we maintain a collaborative approach to our networking with all of those other providers. And thirdly, we provide outreach and education in the community. So you might see us at an event. We do a fundraising and awareness event every year called the Climb Out of the Darkness Walk. We also go to other outreach opportunities, and then happy to provide a lunch and learn or other educational opportunity for someone's organization.
Well, thank you for all that. 3 very impressive organizations and so necessary. We're so grateful for the time to talk to you together today. So why don't we just start at the very basics here, just to make sure we get this covered. What exactly is postpartum depression, and how common is it, and what are the symptoms? What does it basically look like? What are we looking for with this topic here? Who'd like to go first?
I'm happy to start the conversation.
Thank you.
To kind of give an overview of postpartum depression. And postpartum depression is kind of an umbrella term, and another term that's frequently used in our mental health community is perinatal mood and anxiety disorders. And the word perinatal can kind of be used interchangeably with postpartum. It kind of defines the period throughout pregnancy and the first year postpartum. So you might hear the word perinatal, you might hear postpartum depression, postpartum anxiety, PMADS, PMADS, postpartum or perinatal mood or anxiety disorders. So within that umbrella includes, like I said, anxiety, depression. There might even be experiences with postpartum OCD, obsessive compulsive disorder, PTSD from a possibly a difficult birthing experience or previous traumas being triggered. Some women have a onset of bipolar disorder postpartum is the first time that they experience a manic or depressed episode that could potentially lead to bipolar diagnosis. And there also is another postpartum mental health disorder called postpartum psychosis, which is more rare than the other postpartum mental health disorders, but it is a very serious disorder. It only happens 1 to 2 of every 1,000 birth experiences, whereas the other disorders, postpartum depression in general, is about 1 in 5 women who give birth. So it's a high number of people that are affected by postpartum mood and anxiety disorders.
So what are the symptoms, basically? What should people be on the lookout for if they think this might be happening?
Certainly a depressed mood. I think a lot of women experience something called the baby blues. About 80 or so % of women will experience that, which is, kind of a lower mood, maybe crying, maybe more of a hormonal adjustment after the baby is born. Perhaps not as serious, still needing maybe people to talk to and some support for sure, but just that establishment of this new role as a mom. If those symptoms persist, if they start to get worse, if someone is having a lack of enjoyment in the things that they typically enjoy, a lot of, similar post-depression symptoms, but sometimes there is a lack of wanting to connect with the baby. And I say sometimes because I think there's definitely a spectrum, and a lot of people's experiences are unique and different. Anxiety, a lot of worry, difficulty sleeping or sleeping too much, with something like an obsessive compulsive disorder or even anxiety, there might be intrusive thoughts, violent, thoughts or disturbing thoughts that they might have about harm coming to their baby or something happening to them. If there's trauma, it might be intrusive thoughts about the traumatic experience. So those are some of the things to be on the lookout for.
Thank you, Julie, for getting that started. Anything to add, Lexi, on that?
Yeah, I was just going to add just, possible mood swings or the feeling of being disassociated with, yourself, your baby, your family, those types of things. I was just going to add a little caveat. I think Julie answered it beautifully.
Well, thanks for that, too. Obviously, there's far-reaching effects. So I wonder about the effect on spouses and other children in the household, the whole family. Would anyone care to comment on that when this happens?
I can talk a little bit about that just because of our fatherhood program.
Great.
So, dads can get postpartum depression as well. It's not as published, but they do get it because they're going through the same stress the mom is in a little different level. So it obviously impacts them. I think that any family member that's, working with or living with someone who has depression, it does impact them because they're trying to help. Sometimes they don't know what to do or what to say. And, they're trying to pick up responsibilities that perhaps that mom used to take care of, and now they're trying to struggle a little bit. So I think it definitely places a burden on the family that has the mom that's having those issues. And it definitely can impact the dads.
That's important, and I'm glad you brought that up. I think that other question I'd have is, okay, so the dads can get this. Is it possible for someone else to get it? Anyone who's just close to the family to have some sort of impact?
I would say so. I've certainly, in my work in private practice and even through our West New York Postpartum Network, we've had grandparents reach out to us looking for help for their daughters or their families. I think along with dads being, helping the mom who might be experiencing postpartum mood and anxiety disorder, feeling so much pressure to help her, or no one is maybe checking in with him if there's such a big focus on mom. Not that there shouldn't be, but I think it's also important to check in with dad and make sure that he's doing okay, or any partner, regardless of gender, adoptive parents, anyone on that parent spectrum can be affected by this.
Yeah.
And I was also going to add, the children too. I mean, especially if you have older children, they sort of look up to, not sort of, but they do. Your children look up to mom and dad or mom or whoever is in their support bubble and seeing what's going on with them. Why is mommy sleeping so much? Why is mommy sad? Why is mommy crying? So I think adding the children into this too, because they are observing everything that's going on with you. And it is a drastic change, especially if you're going from one child to two or 2 to 3 or 3 to 4. I mean, it is a change for everybody in the situation. So I think adding the children to this, because they can also see it and they can also be affected by it too.
Right. It's so few, it appears so few people actually do seek out help once the symptoms arrive. What are the possible negative outcomes for just toughing it out, riding it out? What have we seen happen as a result of that? LuAnne?
I can jump in.
Oh, go ahead, Lexi. Yeah.
Oh, okay. I think, especially in the Black and Brown community, it's difficult to say, oh, hey, I need help. Or, it's women in general just sort of take on the world, right? But Black women tend to take on more and are put through more. And the biases that are throughout the healthcare system, the lack of access, the lack of representation within the healthcare community, especially the mental health community, can really put those barriers up. And the biases that may be out there, not may, but they are out there, can really hinder a Black or brown woman from seeking help or getting adequate and equitable help as well.
I'm glad you went there. And since we are there now, can you get a little bit more specific about some of the inequities that are seen and how vastly different is the experience?
Okay, so I can speak for personal experience here. I know for a fact that I did suffer from postpartum depression, especially with my second. I had a pretty traumatic experience, which I've had shared a few times, where I had to deliver my baby outside the hospital parking lot because they told me that I wasn't in labor. So here I am, after having this traumatic experience, arguing with the doctor about having to have medicine after, because, birth can be a little messy. And I ended up tearing. So I needed some medicine for the stitching and sewing. That feeling, just thinking about it, just gives me goosebumps. Like, if the doctor, who was literally standing right there in front of me, and I'm asking for help and saying, hey, I don't want to feel this pain, how am I going to trust someone else afterwards to say, hey, I'm really feeling down, or, I really don't feel like getting out of bed. I haven't showered in a week. So, those things, going to the doctors and saying, hey, these are an issue, not feeling confident enough to believe that the provider is going to provide me with that help. So going to the doctors, they ask you, the questions, and then you go, yeah, I'm okay. Yeah, that's, and not really explaining what really is going on, because you don't have that trust, and you don't have that faith within the healthcare space for them to say, hey, this is what's going on. Let me give you a referral to help. And then if you did get that referral, how am I to know that I'm going to get someone that looks like me, right? Have some of the same lived experiences that I have had, in order to help me work through what I'm going through. And not to say that there aren't great providers that don't look like me, that can provide that help, but it may not be perceived as, oh, you're coming from a place of love or a place of caring as well. So did I answer your question?
Yeah, and thank you very much for sharing that. I having a hard time wrapping my head around what actually happened. I can't believe that is what occurred. How common is the story, do you think?
It's beyond common. Like,
it's beyond.
It's 2023. And these things are still happening. Like, I just found out when I had my daughter, she's my second, that things like this were happening I'm almost 40. So when my mom had me, this was happening then. And I know it was happening, when she was born. She was born in the South. So I'm sure it was worse than it is here.
Right. And Matt, I was going to say, Lexi and I have been doing it's, Black Maternal Health Week last week. We remembered it this week. But if you just look at maternal mortality,
right,
Black women are 3 to 5 times more likely to have mortality. Okay. And a lot of the things that Lexi's talking about, one of the reasons they think it happens is because of implicit bias. No provider goes out there to be biased against their client, but if you're not familiar with a certain culture, there's misperceptions about Black women. They're hysterical Black women. They don't feel pain like white women do. I mean, there's a whole plethora of things. And I would say, and Lexi's already heard me say this, that I think that the Serena Williams case was one of the classic cases for this, because this was a Black woman who was educated at every resource, had a pulmonary embolus, pretty much diagnosed herself, and nobody was listening to her. So that's what happens to Black women today. So it's just like common with mental health.
Right.
And then when you add, like LuAnne said, I'm sorry, just going to jump back in with the statistic of dying, 3 times more likely than their white counterparts. And then you add, postpartum depression and some of those other things, you are essentially, increasing that death rate. It could be fatal for our Black and brown communities.
So we have an inherent mistrust of the system, a belief that they're not going to help you anyway, maybe, that could be generational and handed down, and that stands in the way of getting help. And it's not. Yeah, and there's evidence throughout history. I mean, I can sit on this soapbox all day, Matt, and talk about it, but I know we only have a short amount of time. Sure. Well, it's certainly important though, Lexi. So absolutely. Okay, so we have that. What are some of the other issues, though, that are at play that keep people from getting help that they need?
I think there's a lot of myths out there about what motherhood's supposed to look like. I think we romanticize it. I think social media has a huge impact. I have a lot of women that get into the comparison game, consciously or subconsciously, where, you see what people are posting on social media, and you compare yourself to that.
Right.
There are myths around motherhood and how it's supposed to be, how you're supposed to feel the moment that the baby comes out, and you're supposed to just bond immediately because of all of those love hormones, and that breastfeeding, for example, is so easy and so natural. And so moms, that contrary to popular belief, that is not the common experience. A lot of moms, I mean, it's such a shocking and startling experience to give birth and have this baby put on your chest, and like it really can become really surreal. So it does take some time to get used to this, the biggest change that you'll ever go through in your life, of bringing, home a baby. So if a mom isn't, having the experience that she expects to, if she's not having the experience that other people on social media are apparently having, she starts to believe that there's something wrong with her, and there's a lot of shame. I think a lot of the shame is a big part of what prevents women from reaching out for help, because they truly don't realize that this is a really common experience. They think there's something just wrong with them. And I think a lot of women wait and try to muscle through it. And, the nature of some mental health concerns is, 1 week or 1 day is maybe really difficult. And then it lets up a little bit. And we start to think, well, maybe I'm okay. Maybe I'll just wait. Maybe next week I'll let it go. And so oftentimes we have women reaching out to us at 9, 10, even 12 months postpartum, but they've been suffering since 1, 2, or 3 months postpartum. I think the messages that they get from well-intentioned friends and family, right? A lot of normalizing, but not necessarily normalizing in a way that gives her a platform to get help. So normally, like, oh, I went through that too, it's normal, you'll get through it, versus, hey, this is a really common experience that women have with postpartum depression, and also there's help available, and there's no shame in getting help, and let's help connect you with somebody who knows what they're doing and can give you some guidance.
So the normalizing almost becomes dismissive, as opposed to normalizing the getting help part, the part B.
Yeah. I love that you said that, Julie, about, normalizing this. I think we just don't have honest conversations of what your body goes through, what pregnancy looks like, and that it's fine if you don't have, that snapback that everybody looks for when you have a baby. Like, your body changes so much throughout the pregnancy. And I don't remember, maybe it could have been like a couple years ago. Do you remember that Frida commercial where they talked about, they gave like an accurate depiction of what postpartum looked like at home when a mom was getting up? She had on those, the granny panties and the pad and all of those things. And I'm sorry, Matt, but like, that is what people really need to talk about. They give you this fantasy of like, oh, you're going to be so pretty. And not that people aren't, because I think pregnant women are beautiful. Okay. But like the backaches, the things, but those things come with it. I think if we really have honest conversations of what pregnancy looks like, the good, the bad, the ugly, right? That I think we would have a better grip of what to expect too.
Yeah. It's not like the Kardashians. That's what people
It show it, because I got 3 kids and I got all of my marks to show me that I had them. Okay. And I will proudly show them at the beach.
Is there a fear among women that if they admit to having some of these mental health issues, that someone's going to take the baby away, or some?
Oh, absolutely.
We see that every day with our clients. I mean, when because we screen, our moms, but several years ago, we noticed that it was in my community health worker program, but that we were seeing women that were scoring high, and they do not want to go to a formal provider because they're afraid CPS is going to come in and take the baby away. So what we had to do was we contracted with, at that point, it was Horizon Health to come in, bring a mental health counselor in once a month, and we still do it. And we're actually going to expand it to Healthy Families this year. And she works with them on techniques to deal with the depression. But our real goal is to get them comfortable with counseling, so they will go on to an individual counselor, and most of them have. So there's definitely a fear, especially if you're a Black woman, that CPS is going to be knocking at your door and taking that baby away.
Yeah, I agree. I mean, I had a scare a few years ago with my son, and if you have boys, you know that they don't sit down but for 2 seconds, and that's to eat and to go to sleep. So, having the issue that I had with him, he ended up having a bubble fracture, but nobody would diagnose it. Like, my son wasn't walking. We were in the ER 3 times in a week. And I was like, I'm not going back, because if I go back there, they're going to assume something, assume that, I'm a bad mother, or, my husband is a bad father and there's abuse in the home. So it's so prevalent within the Black and Brown community, because,
Yeah.
Yeah.
We see
And
that.
what I can share in terms of, just from a clinical perspective is, a lot of women either that have some postpartum anxiety, or a lot of women in general, but specifically if they have postpartum anxiety or postpartum OCD, that comes with the symptom of intrusive thoughts. And sometimes those intrusive thoughts can be very, very disturbing. I've heard them all, right? And so these thoughts just spontaneously pop into a mom's head, and sometimes they might involve a thought of harm coming to their baby in some violent way, or themselves. What if I lose control and harm the baby? Now, and this isn't that they actually are a danger to their baby. Most of the time they're not. This isn't psychosis. This is just an intrusive thought. And then they're really disturbed by the thought that's just come into their head, and they are very, very ashamed by it, and they don't want to tell anyone. It's hard for them even to tell me as a therapist, or to tell their doctor or midwife, because they believe if anyone knew what was going through my head, they would believe that I'm a dangerous person, and they would take my baby, because obviously if I'm having this thought of dropping my baby or hurting my baby in some way, then I must be a dangerous person. So there's a lot of shame that they carry with those types of thoughts.
A lot of reasons why, obviously, this is all happening. And for those that are just joining us right now, I'm Matt Smith from the Erie County Anti-Stigma Coalition, and I'm joined by LuAnne Brown, CEO of the Buffalo Prenatal Perinatal Network, Lexi Harrod, Vice President, CEO, and founder of Melinated Moms, Western New York, and Julie Rosinski, co-director of the Western New York Postpartum Connection. We've been discussing the unique stressors and challenges that women and families can experience in the year after a pregnancy. And we'll be talking even more about the role of stigma as an impediment to dealing with these challenges. Everyone just joining us, please do take a minute and check out our website, letstalkstigma.org, and maybe join the nearly 4,000 others in taking the pledge to end stigma. Also, if you are connected with a business, organization, or faith community, you can become an organizational member of the Anti-Stigma Coalition. You can find information for this on the website under the members tab. So now back to our panelists. So we started to get into stigma a little bit. We talked a little bit about shame. We talked about very real fears that many women might have that are experiencing this, systemic and otherwise, and other worries, and this idea of an ideal of what a woman should be or a mother should be. We haven't really mentioned the word stigma yet. I would like to know if anyone would like to just start talking about stigma specifically as an impediment to this issue. How big of an issue is it? LuAnne?
I think it's been.
I was just going to say, it's, as we mentioned, I think it's very prevalent in the Black population. I also see with our Hispanic moms, for whatever reason, it's a cultural thing. They have to be strong. It's admitting weakness, but I definitely see it in our clients that we work with every day.
Okay. Anything to add, Lexi?
I think stigma just creates biases, and it leads to racism in our system. There's many instances in history that have proven that, and I think it needs to go away. It really does. It just needs to go away. It has to start with how we educate our providers, how we educate ourselves, and getting rid of some of those preconceived notions about, you know, what a culture looks like, what a Black woman looks like. You know, if I want to go in and get help, I want someone to see me, right? Not just assume because maybe I'm upset, maybe I'm at my breaking point and I'm crying and I'm frustrated, and all you see is an angry Black woman, not a woman who is literally at her wit's end and she's making a cry for help. Like, I want to be seen and not judged.
Well said. Well said. We have some questions coming in the chat box right now. And anyone that is watching us right now, please do just add a question into the chat bar and we'll try to get to them, as many of them as we can. This question is, as a spouse or partner of someone struggling with postpartum depression, when should you step in? Especially as a first-time parent, should you consult a professional before you do? What's some advice there for the spouse or partner about stepping in? When is right? How do you do it?
Go ahead,
I would
Julie.
say don't wait. I would say don't wait. You know, I think it's okay, you know, with a loving approach, with a positive and caring approach, just to kind of ask her truly how she's doing, and maybe gently talk about some things that you've noticed as a family member or a partner that have concerned you. You know, don't approach it in any sort of accusing or negative manner, but really approaching it from a place of love and concern. Some people don't want to hear it yet, aren't ready to hear it yet. And I think that's okay, unless there's something that's inherently, you know, dangerous or an emergency. If you're concerned about postpartum psychosis, or if you're concerned that they're a danger to themselves for some reason, or suicidal, that's a different story. But just if you're kind of questioning, you know, she just doesn't seem like herself, she just doesn't seem right, definitely getting some information for yourself as well, through any of our websites, and there are also a lot of great national resources out there too, just to kind of educate yourself, and maybe even as a way to share with your partner, you know, some of the things that you've seen online. It might come differently if she sees it from a resource or another perspective.
Mm-hmm. I echo everything Julie just said, but also I wanted to add, you know, when you come home from the hospital, if you're a first-time parent, they give you this like packet, and it's like a little overwhelming. It's a big packet of information, but I think it's either like on a blue sheet or a green sheet, and it lists all the things that signs and symptoms of postpartum depression that you should look out for. I distinctly remember my husband going through every day, do you feel this? Do you feel that? And though we laugh about it now, and I go, you were being so annoying, but he was really, you know, trying to see, you know, hey, are you okay? Are you there for, you know, I'm here for you. And sometimes we just need somebody just to listen. You know, I remember coming home and my baby he looked like a little burrito. And I just had a whole moment. Like, I bawled going, oh my God, I have to take care of an entire human. Like, right. What am I, that is such a weight to be like, now I'm responsible for a whole person, you know, from now until I can no longer breathe. Right. So just giving that time, giving that space to really listen to your partner, and seeing, you know, hey, are you okay? And sometimes just give me some tissue. Sometimes just give me a little pint of ice cream. Okay. A little gelato goes a long way.
I was going to say, Lexi, same story. And of course, and I'm a nurse. Okay. And I'm sitting there, I come home, an OB nurse. And I remember, you know, and he was a good baby. He wasn't colicky or anything. I kept looking at him like I was supposed to be doing something with him. And I remember calling my friend who ran the newborn nursery, saying to her, how am I going to keep him off drugs? Okay. He was like 6 weeks old. But you start to think about, you know, the responsibility that you do. You have this child now that you have to be responsible for, but we all feel it.
Right.
Goes into the stigma. Oh, sorry.
No, you go.
I think that goes into the stigma question as well, right? Those losses that LuAnne and Lexi are talking about, the overwhelm, that maybe even some thoughts of like, I miss my old life, right? I think we aren't given permission, like we've been saying. It's important to have honest conversations. That's a real thing. It doesn't make you a bad mom to feel overwhelmed or to kind of pine for parts of your old life. Like those are real losses that happen when we become mothers, and that contributes to the stigma as well.
Right. And I think that goes back to those honest conversations of what, becoming a mother looks like, those changes that you don't expect. Yes, I'm going to gain some weight. Yes, I'm going to be up late, but I also don't have the freedom to be like, all right, I'm going to Walmart. It's 2:30 in the morning and I can't. Walmart's not open 24 hours anymore, but you can't just pick up and go like you used to, So that sense of responsibility is something that I think we should really, be honest about.
Right. And having feelings doesn't make you a bad person.
Right.
That's an important message, I think, right there too. So well said. We got another question on the chat box, which I want to get to as well. The questioner says, I feel like the concept of baby blues seems to downplay the issue as too normal and not big enough to warrant help. It's okay to just need someone to talk to about this massive life change. Are there programs out there, support groups that feel less intimidating than a therapy session? Anyone care to comment on that one? Who wants to take it?
I do.
Well, go, Lexi, go.
Oh, yes. We have a support group that we hold it every second Saturday of the month. And we do it virtually because we want to try to, get as many moms and women involved as possible. And what I love about it is that we get people from all walks of life. I mean, we get white, we get black, we get purple, we get green, and we're able to just really sit there and, sort of take the societal mask off and just take a deep breath. Right. And we usually have different topics that we discuss, but we provide that safe space for moms and women to just come in and take that deep breath and go, hey, this is what's going on with me. What about, you know what? That happened to me too. And we provide that sense of community that way. And I love our support group. It's so nice. We have to do it outside one day since we're not on punishment.
Very nice. Well, what could be done to make that less daunting? What could be done to make that more welcoming? Is this about language or marketing or what could we do?
I think adding representation to it. Go ahead, Julie. Go ahead.
Yeah. No. It's been tough since COVID, honestly. And, I totally agree with the person that made that comment. I always tell moms it's never too early to reach out. You don't have to wait until things are bad. Even if you are only 2 weeks postpartum, even if you're pretty sure this is just baby blues, still talk to somebody. And it doesn't, and even if you are struggling more, that community support can be so important. Like Lexi was saying, even having somebody just saying, oh, I went through that too, or I'm experiencing that as well, can feel like such a relief. We on our website do have a listing of support groups. We're actually redoing our website, and our website's going to be completely different, hopefully by Mother's Day, and a lot more accessible and easy to find things. But COVID kind of made it difficult for in-person support groups. So some of them are slowly coming back. There's a lot of really great online support groups, which I think, it has its pros and cons. And I think what you're saying in terms of access and making it less intimidating and stigmatizing, that an online support group might be a good first step, because you could, not that I encourage it, but if you really wanted to, you could turn off your camera. You could just listen. You won't probably bump into these other people in the community. But that can be limiting too, because I think a lot of people do make good, one-on-one connections through support groups too. And I have had a lot of people reach out recently looking for in-person support groups because they want to, connect and sit in a circle and be with other women in person.
That's great. I think, one thing about COVID, it did kind of bring in this way of communicating and make that more normal and accessible for everybody. And we do know that distance and transportation can be sometimes a big impediment to people getting what they need. And And there's, of course, also that social element. So stigma, what else are we doing to really kind of get beyond that? I mean, we talked about how are we, what are we to do? What's the secret in the sauce? What are we working on to make this more normal and easier to admit that there's an issue and seek out help? Any thoughts or ideas on that?
I think having conversations like this are starting that conversation. Working with different organizations like Western Europe Postpartum Connection and BPPN, letting people know that, hey, there are services out there, and being able to coordinate with each other to sort of extend that reach. I know Western Europe Postpartum does an amazing job going, hey, I have a mom that's looking for a doula, or I have a mom that's looking for a therapist. This is this and this is that. And no lie, there's like 5 or 6 people that are like flying off the connections within the community. Those grassroots connections, I think it's great, because I think when you sort of think about it at the high level, like at the doctor's office or at the hospital, it sort of feels like a little unattainable. But when you have these grassroots organizations that with the boots on the ground, that really makes a difference in getting access and elevating the voices of those that we serve.
Mm-hmm.
Anyone else have something to add on that?
I think similar to what Lexi's saying too, like just trust in the community and the networks that we're all a part of, and the collaboration that we have builds trust. You know, if Lexi is someone that she wants to refer to me or to one of my colleagues, it's more likely that that person will follow connection with them. I think that this is a good person. It's kind of like you were saying, less intimidating than just handing somebody a card or saying, well, here's you're on your own, versus more of, I guess, what we sometimes say is a warm handoff, so we don't lose them in that process.
Right.
To have those personal connections.
And I think the support groups that we do, not just we call it the empowerment group, but even our breastfeeding support groups, I think the fact of sitting there with women that look like you, and breastfeeding also has a stigma for Black women because of the history of years ago on the southern, plantations. So some of them have never seen another woman breastfeed. And I think that helps them, just like the empowerment group helps them to hear other women, so they don't think it's just them that has these feelings and these thoughts.
Mm-hmm. Yeah, I agree.
Well, again, it's about conversation. It's about normalizing conversation. It's about replacing myths with facts. It's about garnering trust. It's about all these different things that are, of course, helping to get to a better place, I think. I like stories often when I am in conversations like this. And I don't know if any of you might have a story of a person, no names necessarily, but a person who realized that postpartum was what was going on and sought out help, and how that went. Is there anyone who would care to share anything?
Yeah, I mean, I can share one, just because I remember it was our first empowerment group. Of course, my staff person that goes in to help facilitate, I mean, she came out and she's like, I'm depressed now. I mean, it was really intense. And one of the women, it was a small group, like 5 people. Mm-hmm. And one of the women said, once they got into it, she said, I'm so glad I came, because I had a knife at my wrist yesterday.
Wow.
And she ended up staying with the group. She ended up going to individual counseling, and she's fine now, but it was scary to us that people, were in that position, that, how scary, how on the edge they were, that could have happened. So that one always sticks with me, because it was our very first group, and it just kind of reinforced for us the importance of having that group.
Thank you for that. Anyone else have one?
I'm not necessarily like an individual situation, but as and I do, but hesitant to share any like personal details about anyone that I've worked with. But I do have a lot of women who incorrectly believe this is just how they are now, that this comes with the territory of motherhood, that they have to just get used to it. This is their new life. And I have had women that had been very difficult to convince otherwise, or to show them otherwise. And one thing that they don't realize that these are symptoms that are treatable through therapy. And another big thing that comes up a lot that goes along with, I suppose, the stigma piece is the option to take medication. That some people will opt to use medication as part of their treatment, and if they've never taken medication, an antidepressant, for example, before, or there's negative attitudes toward what that means, or I do have some women whose family members have strong feelings about taking medication. Perhaps they're on board and willing to try it, but their spouse or their mother or other person in their circle has said some negative things or shared their own personal negative experience with it. But sometimes, sometimes women really, choose not to take medication, and they do well with just therapy and support. But other women really, it is the push that they need, or it is the thing that really helps get them back to their baseline. And so the realization when they finally do have a positive effect from taking some medication in addition to their therapy is really huge for them.
I know one of the things that we've talked about quite a bit through this discussion is the idea of how everyone else will perceive you. How will you be perceived by other women? How will you be perceived by the system? How will you be perceived by your family? If you admit that this is what's going on, and how do we get people to overcome that specifically? I mean, is it about learning to not care so much about that? Is it about making them understand that most people don't feel that way? I don't know. What's the messaging there to moms?
I think we have to tell them, like Lexi's mentioned, that, you do education with them so they can say, if it happens, when you're pregnant and in your, pregnancy glory and excited about having a baby, you're not thinking about the downside. So I think it's important to say to them, listen, this may or may not happen, but so at least they hear it at least once from somebody. So I think it's the education. And then I think if they do lapse into the depression, it's also saying to them, this is very normal. 35%, whatever the numbers are now, Julie, of women get postpartum depression. So this is not, you're not in the minority here.
And I would also add to that, I would always let them know, listen, you are doing a great job, right? It might not feel like it. It might not, you might not see the results of all the hard work that you're doing right now, but you're doing a good job. I would tell moms to, it's totally okay to feel how you feel, and to seek help. I wish I would have had that when, I was having babies. I quit now, but I wish I would have had that. It's okay to feel sad. It's okay, to feel all those feelings and to sit there if you need to. It's okay to cry. I know now, my kids are 5, 8, and 2. I did that all backwards, but I literally sometimes I just go in the bathroom and I have a good cry. And sometimes I'll have to go into the car because my kids don't let me go to the bathroom by myself. But, just being able to have that moment to yourself to do that, and really just providing that encouragement and to seek that support, even if it's in a friend. And I know sometimes you can't always go to a family member because they'll sort of put some of those pressures, those societal pressures on you as well. You're a mom, this comes with it. Like you said, Julie, this comes with the territory. Get a friend, get an outside person. If you can't, find a therapist right away. I had a friend, we called each other the breasties because we would be up at 2:00 in the morning nursing our kids. And I would call her and go, hey, are you up? She goes, yeah. I'm like, listen, I just need to cry, because she understood what I was going through the breastfeeding journey with our kids. And I swear they were like in sync. They would eat the same time, all of those things. So looking for that support, be it if it's with Melinated moms, be it with BPPN, be it with Western Young postpartum, having that support and someone that has those same lived experiences as you is key. So try to seek that out from your community. If you don't have one, come join ours.
That's really a great message, and I'm glad you went there to friends as well as family. Those supports are so important. And I guess we're getting toward the end here, but I'd like to just talk briefly. What would the messaging be to families who are, maybe about to deliver or who maybe have just delivered. What's the key takeaways we'd like families and loved ones to know? What should we be looking out for? What should our role be? What should we be doing to help?
It is important to include it, I think, in planning. You know, for as much as we plan for preferences around our births, as much as we plan for the nursery or other equipment that we might need, and I know that you know, doctors and midwives and pediatricians and all of us, the community at large, is getting better about talking about this, and hopefully in childbirth preparation classes that this is a possibility. We don't want to scare anyone, but it's something to stay aware of. There are great tools and resources out there to start the conversation, especially between spouses, especially if you have a previous history of a mental health concern or you've had previous postpartum depression. Just have the conversation. Come up with a postpartum planning, you know, idea around what tangible hands-on support you're going to need and where you're going to get that, what emotional support you're going to need and where you're going to get that, who is in the community that has this information or has these resources. Maybe I have women that come in and they aren't experiencing any symptoms currently, but they want, you know, tools for prevention. So I think it's important to acknowledge it as a real possibility that no one is immune from. And, you know, again, not a scary conversation, but an honest conversation about it.
I would also add, get yourself a doula. Okay. Get yourself a doula. Add them to your care team too, because a doula will spend more time with you than your OB or your midwife. They'll see you prior to you having your baby going into labor, and then they'll see you after. So they'll have a better baseline of understanding of, you know, who you are. And if they start to notice those signs, you know, they can point you in the right direction. You know, hey, maybe you should go talk to, you know, your OB. Maybe you should tell your OB this. Maybe you should tell your provider this. And, you know, they're not to say that the OBs and the midwives, you know, don't provide a great service, because they do. But, you know, having that person that is with you throughout that journey and after can help eliminate some of those barriers too. They can sort of break down those walls for you. And there's studies that show that doulas help reduce the rate of postpartum depression, especially in Black and Brown communities. So go ahead, get you a doula, because they're amazing.
Great advice.
Or a community health worker.
There
or
you
a family
go.
support specialist. No, it's just somebody, like the doula is the same with, you know, with our staff, because they spend so much time with the moms. And Lexi's right. When you spend that much time with someone, you know what their normal persona is. So, and you can tell when something's off. So, and they have a trust level with the doulas, with the community health workers, with the family support specialist.
Right.
Well, I want to thank all of you for all that you shared today. I think this was a really helpful and wonderful conversation. And thank you for all the work that you've all been doing on this very, very important topic. As a reminder to our audience, we need you to take the pledge to end stigma by joining at our website, letstalkstigma.org. If your organization would like to join us in our cause, there's information on the website as well. Just click on the members tab to find out how. Together, we can reduce stigma and create an environment of support where help seeking and help giving are the norm. Once again, I'd like to thank our panelists, LuAnne Brown, Lexi Harrod, and Julie Rosinski. I'd also like to thank everyone behind the scenes, Mike Telesco from Telesco Creative Group for his vision and technical support, Carol Doggett from the Mental Health Advocates of Western New York, and Karen Karaszewski from KKPR Buffalo for their support as well. We really hope you join us on the regular for our Facebook Lives. Our next one will be on May 17th, when our topic will be the state of stigma, handling grief and loss. We hope to see all of you there then. Another important topic, another opportunity for us all to get together and talk. So on behalf of the Erie County Anti-Stigma Coalition, until next time, I'm Matt Smith. Stand up to stigma and good luck on your wellness journey.